So some of the combinations, examples of some of the combinations include Symbicort, which is budesonide with formoterol. Budesonide being the corticosteroid, formoterol, the beta agonist. Advair is fluticasone and salmeterol. Fluticasone being the corticosteroid, salmeterol being the beta agonist. Same way, Tulera is mometasone, the corticosteroid, and formoterol, the beta agonist. So these combinations are available, and they are now the preferred regimen for asthma management and COPD management. Good. Another class of drugs that we can use in the respiratory system are the mucoactive medications. Now, when we say mucoactive, basically saying these medications can modify the mucus that is, or the sputum that is produced in the respiratory system. So these are used to modify the respiratory secretions or the phlegms that are produced. They include mucolytics, basically used to break down at the chemical level the mucus. So these mucolytics, as the name implies, mucus-lytic breakdown. So these break down mucus at the chemical level. Basically, they break down the chemical bonds that keep these mucus molecules together. Once they break these mucus molecules, break them apart, it makes them thinner and easier to remove. So once we've taken these medications, coughing will make it easier to remove the phlegms because it's been broken down into smaller pieces. Examples of such agents include ambroxol, carboxyl, bromhexine, and acetylcysteine. Then you also have expectorants. Now, expectorants, on the other hand, they do not work on a chemical bonds, but expectorants add on to the secretions by adding water. So basically, they increase the water secretions. And when that happens, basically, it means the water dilutes the mucus. And in doing so, thins and loosens the mucus. And this way, it's easier to expel through coughing. Mostly when you are using expectorant, we advise our patient to drink a lot of water because we want to just help increase the water that is thinning the mucus. So it's advisable for expectorant to add a glass of water when you are using them. Examples of such drugs include guaifenesin, epaquana, potassium iodide, and ammonium chloride. Then there is a third group, which is known as the mucokinetics. And basically, these ones help increase the mucociliary clearance of the mucus through your throat or through your respiratory system. Good. So those are the three mucoactive medications that we use to do something about the mucus or the secretions from the respiratory system. The next class of drugs are antitussives or cough suppressants. Now, antitussives or cough suppressants are used only for dry cough. They should only be considered for dry irritative cough, simply because these coughs do not involve sputum or phlegm production. Now, why is this important? When we talk about antitussives or cough suppressants, they basically work by affecting the so-called cough reflex arc in the brain. This way, they suppress the urge to cough. And in suppressing the urge to cough, it means it suppresses the agent, the person or the patient from coughing. And if there is sputum or if there is phlegms and this patient is not bringing it out, that phlegms can also be a reason for suffocating of that patient. Notice when we talk about the mucoactive agent, we were all, the agent, after the activity, the patient was still coughing the phlegms out or moving the phlegms out. But if there is phlegms and we are suppressing the urge to cough, those phlegms could accumulate, and then you will end up causing your patient to suffocate on their own phlegms. So we do not use antitussives in wet cough. We use antitussives only in dry cough. Only in dry cough. Examples of antitussives include dextromethorphan, codeine, codeine. All right. Then the next class of drugs are antihistamines. Antihistamines also work by affecting the effect of histamine. And histamine is a chemical that is really used in the immune system. It is released in the immune system, and its responsibility mostly is to cause inflammation during allergic reactions. So antihistamines are used for cough associated with allergy. Coughs associated with allergy, and it helps with the allergic symptoms. And they also help in reducing the inflammation by stopping the activity of the histamine. Now note that this histamine is working on histamine H1 receptors. In digestive pharmacology, we talked about H2 receptors when we were producing HCl, hydrochloric acid. Here, the same histamine that is working on the H1 receptors, and this is found in the respiratory. The H1 receptors are found all over the body, but this is more in the respiratory system, since that is what we are dealing with. There are two main types of H1 receptor antihistamines, those that cause sedation and those that do not cause sedation. That's important because when you're going to give these drugs for allergies in your patient, cough associated with allergies, you want to also be sure you are those that are going to be sedative. You may not give it to patient that's using heavy machineries, patient that is going to be driving, patients that are going to be doing things that sedation can lead to other damages or other risk complications. So for such patients, you will be interested in using a non-sedative antihistamine. Whereas if you want your patient to be resting, sleeping, you can use the sedative antihistamines. Examples of the sedative antihistamines include diphenhydramine, chlorpheniramine, promethazine. An example of non-sedative antihistamines include loratadine, dexloratadine, fexofenadine, and cetirizine. The next class of drugs that we can think about are the respiratory stimulants or the analeptics. Now, these are used to stimulate the central nervous system. And so they are only used in emergency situation where we have a respiratory depression, an emergency respiratory depression, and we want to stimulate. We can use a respiratory analeptic stimulant. Example include aminophylline, dozapram, and caffeine. Then we have the aromatic inhalational agents, which basically are the ones we find in our inhalers. So silverbird contains eucalyptus, menthols, or peppermint. These are all aromatic inhalational agents. Then we have xylometazoline. Xylometazoline is described as a sympathomimetic agent, basically meaning it acts on the adrenergic receptors, and it acts by causing the constriction of blood vessels, the nasal blood vessels. Vessels are the nasal region. And by doing so, they take the blood vessels away from the surface of the mucus, leading to the dryness of the phlegms at that point. So they are also described as decongestants, and they work on the alpha adrenergic receptors. Finally, oxygen. Oxygen used in a situation of hypoxia, low level of oxygen. When a patient is hypoxic, we need to increase the alveolar oxygen tension sample. Sometimes we're doing surgery and we can put this oxygen in there. And this helps to decrease the work that the patient's respiratory system will have to do in breathing. This is also in emergency situations or in a surgical situation. All right, so these are some of the drugs that we use in the respiratory or the pulmonary system, and we use for diseases as and when it may be needed. All right. Now, here's an important note. Even though we've mentioned it, let's just repeat it. Respiratory diseases may be caused by and or may be associated with bacterial infection. We kept mentioning infections, especially with productive cough. And we are saying that infections could be bacteria. If it is bacteria, we can use antibiotics for their treatment or for their management. But we still want to insist that for children, most of the cough, productive cough, is not caused by bacteria, but it's caused by virus, or it could be an indicator of asthma. So before you go writing antibiotics for children for respiratory infections, you must rule out asthma and viral infections before, and you must confirm bacterial infection before you go ahead and use antibiotics. Otherwise, using rampant antibiotics in children is one of the ways we are not managing our antibiotics properly. We are not being good stewards of our antibiotics. How do we get our drugs to the patient? In what forms are the drugs made? So mostly we could give the drug as an inhalational agent through the inhalational route. This is the preferred route because one, it gives the drug directly to the airways. And in that way, you can reduce the doses that is required for the patient. And in reducing the doses, you also reduce the side effects that may be associated with the drug. So inhalational route is the preferred route. But other routes that are available includes the oral route, where we can use pills, we can use syrups, and then there's also the parenteral route, where we can go through the intravenous route or the intramuscular route. But again, remember, our preferred route is the inhalational route. Of the inhalational route, here are some devices that we are able to use to help deliver drugs through the inhalational route. Now, the pressurized meter dose inhaler, which we can see in the picture. As you can see here, this is a picture of the pressurized metered dose inhaler. The pressurized metered dose inhaler. This is an example, a typical example of that you can see in our picture. Then we can also have the breath-actuated inhalers. We have the dry powder inhalers. We have the nebulizers, which are mostly machines that helps the patient to breathe. These are some of the devices used in the inhalational route, used to deliver inhalational medications to our patient. There's also the peak flow meter, which is a tool that is used to measure a person's peak expiratory flow rate. Now, this measure of peak expiratory flow rates is actually needed, or is also important to check as a guide to help you notice if your management of asthma or your management of chronic obstructive pulmonary disease is effective or it's not helping your patient. Now, what is this peak expiratory flow rate, PEFR? It basically means how much air can a person quickly force out of their lungs in one breath. So this tool measures how much air a person can quickly force out of their lungs in one breath. And that measure can help us notice whether there is improvement in management or there is a decline in management. Here are some general tidbits, some general care tidbits for the lungs. Smoking is a no-no for the lungs. Avoid smoking at all times. The nicotine affects the lungs and it is not healthy for the lungs. So avoid smoking. And this includes, as much as possible, secondhand smoking, where you are not the one doing the smoking, but you're exposed to the smoke as well. If you can avoid secondhand smoking, avoid that. Also, avoid exposure to air pollutants, whether indoors or outdoors. Try to avoid these pollutants. If you can, increase your exercises. Exercising is very healthy for the lungs. It helps the lungs to go through its regular exercise. Now, we want to practice personal hygiene or practice preventive infection prevention methods, which includes personal hygiene, like washing of hands with soap and under running water, or using of alcohol-based cleaners where you cannot use water to do the washing of the hands. As much as possible, doing all your best to practice good oral hygiene so that you can protect yourself from germs in the mouth, which could affect your respiratory system. Use vaccination as a means to also prevent infection. As much as possible, get vaccinated where you can. And if you can, protect yourself from people around you, especially if you get sick or if you are in a crowd where you are in a season where people are having the flu and the cold or these respiratory diseases. You can avoid the crowded group to protect yourself. And finally, regular checkup or checkup is something that you should also do as much as possible. Regular checkup. All right, so these are some few things we want to talk about the respiratory system and how we are able to help it with medications. I believe it has been helpful to you. So this is where our lesson will close. Thank you for listening. Please subscribe to the channel, hit the like button, and have a wonderful rest of the day. God bless.